Another day, another story. Please subscribe and like at 365 How. Insulin resistance is a condition in which the body's cells become less responsive to the effects of insulin, leading to elevated blood sugar levels. It is often a precursor to type 2 diabetes but can also have implications for overall health. Here's a look at the relationship between insulin resistance and health. 1. Type 2 diabetes. Insulin resistance is a key factor in the development of type 2 diabetes. When the body becomes resistant to insulin, the pancreas produces more insulin to compensate. Over time, the pancreas may struggle to keep up with the demand, leading to high blood sugar levels and eventually diabetes. 2. Metabolic syndrome. Insulin resistance is strongly associated with metabolic syndrome, a cluster of conditions that include high blood pressure, abnormal cholesterol levels, increased abdominal fat, and elevated blood sugar levels. Having metabolic syndrome increases the risk of heart disease, stroke, and other chronic conditions. 3. Weight gain and obesity. Insulin resistance can contribute to weight gain and obesity. When cells become resistant to insulin, glucose is not efficiently transported into the cells, resulting in higher levels of circulating glucose. This excess glucose is converted into fat, leading to weight gain and an increased risk of obesity. 4. The elevated blood sugar, high blood pressure, and abnormal cholesterol levels associated with insulin resistance increase the risk of heart disease, heart attacks, and strokes. 5. Polycystic ovary syndrome, PCOS. Insulin resistance is frequently seen in women with polycystic ovary syndrome, PCOS. Insulin resistance can contribute to hormonal imbalances, irregular menstrual cycles, fertility issues, and an increased risk of developing type 2 diabetes. 6. Inflammation. Insulin resistance is associated with chronic low-grade inflammation in the body. 7. Liver health. Insulin resistance can affect the liver's ability to regulate blood sugar levels. It can lead to an overproduction of glucose by the liver and an increased risk of non-alcoholic fatty liver disease, NAFLD, which can progress to more severe liver conditions, such as liver fibrosis and cirrhosis. 8. Mental health. Some studies suggest a potential link between insulin resistance and mental health conditions such as depression and cognitive decline. The mechanisms behind this association are still being explored, but it highlights the importance of overall metabolic health for brain function. Managing and improving insulin resistance involves lifestyle modifications, such as consuming a diet rich in whole foods, high in fiber, and low in refined sugars and carbohydrates. Managing stress levels through relaxation techniques, exercise, and sufficient sleep. By addressing insulin resistance and adopting a healthy lifestyle, it is possible to improve metabolic health and reduce the risk of developing type 2 diabetes and other associated health complications. It's important to work closely with healthcare professionals to monitor and manage insulin resistance and its impact on overall health. If you like the video, please subscribe and like at 365 How.